And I've been talking a lot about, house call, my encounters, and I want to just ask Ari questions because I don't know how many persons have ever watched when the home health aides come into their home, and especially the caregivers or the family members. A lot of them, they are just wondering, why are they just doing that? Why are they not helping out more? Or even sometimes you're probably asking yourself, why are they even just doing that? And this is what you're paying for, because the amount of money that you're spending, it doesn't seem like the work that you're getting is not worth it. And so we're just going to talk a little bit about how much the home health aides are getting paid at, how much agencies are being billed at, and why the families are just feeling so frustrated. If you're new, I'm Stacey, and I want to say thank you so much for tuning in. If you hear the noise in the background, sorry. But this channel is all about, transparency in healthcare. We talk about education. We talk about how we're helping families understand how the system actually works in healthcare, because a lot of us, we don't really know much about it. And this topic is something that is very important because home health aides, yes, a lot of times we tend to blame them for things that are completely out of their control. Yes, you might be sitting down and you probably have a home health aide and you feel as though, they're not doing much. But let's just start out here with the number one thing that a lot of us are complaining about, the money. Because this is where a lot of the assumptions come in. When it comes on to the amount of money that they're getting paid at, the average hourly pay. In most parts of the US, home health aides, they're working through an agency. And that agency is being paid anywhere between like $12 and $20 per hour. And that not really sound like a lot of money. And realistically, you have to think about if they're entry level, Medicaid funded cases, it can be anywhere like $12 to $14. Average agency cases are up to $18. And you can have like $19 to $25, which is higher end. And you can have private duty, which can cost a little bit more. So no, most aides are not making anywhere like $40 or $30 an hour. They're working so much less. But let's just talk about the part that have family members, talking. Because you have insurance that are billing like $35, $45, but how much is the nurses getting, the aides getting? And this is where it's a little bit frustrating. That's where family members tend to start asking, where's all of this money going? So let's just look at the difference between the bills, you understand? What's billed and what the aide is being paid, what they actually go home with, and what is actually running the agency. Because when you look at an agency, they have to take into consideration payroll taxes, they take into consideration workers' compensation, liability insurance, background checks, training, scheduling, staffing, documentation system, supervision for the nurses or the aides, state and federal compliance. And by the time you look at it, all of what is left is what the aide is coming down with at the end of the hour. You understand? The system is not perfect. It's not, but it's just how it is structured. So we just have to try and understand a little bit on that. But the family members, yes, they're struggling, and they're struggling a lot because home health aides, they're not nurses. They have no clinical license. You understand? They must follow strict plan of care. And so what they're allowed to do is things like bathing. They're allowed to do personal hygiene, dressing, grooming, toileting, light, housekeeping related to the patient. They can do simple meal preparation and basic assistance, mobility assistance. What they cannot do is administer medications. They can't give insulin injections. They cannot perform certain wound care. Complex dressing changes, they can't do it. Manage IV, tube feedings, make certain medical decisions, no. So if an aide does something outside of their scope, something, will go wrong. The aide, the agency, they're both legally responsible. So you might find out that sometimes you might say to the aide, can you do this? They say no. Just understand that they cannot do it. Some persons might just say, they're lazy. It's not lazy. They're just making sure that whatever they're doing is within their scope. And a lot of times, even if they do something, the insurance won't pay for an authorized task. Agency can be fined. The aide can lose certification or their job. So they're protecting their livelihood at the end of the day. And that's just it. Just like me, when I go out there, I know everything we do. You understand? Most home health aide visits, they're very time authorized, meaning insurance might authorize them to work only 30 minutes, 45 minutes, or 1 hour, and that's it. So if the aide stays any longer, oftentimes they don't get paid, and the agency doesn't either. So guess what? Nobody's going to stay an extra minute over the time that they're not getting paid. They're going to always be finding another job to supplement, because remember, the amount of money that they're working per hour is not enough to even take care of themselves. So this is the part I really want persons to understand, is that most of the aides, they really do care about the patients, they really do care about the patients, but as usual, they're understaffed, they're underpaid, they have to work multiple jobs, and it's very exhausting mentally and physically for those persons. They want to do more, but really and truly, they cannot do more. They cannot. They just have to move on to the next patient. So this is where sometimes the confusion happens in home health. You have insurance based, you have medical necessary. It is very time limited. You have strict rules. You have private care that is more out of pocket, flexible, longer hours, fewer restriction. If you want someone to stay with you longer and do more for you, you can always ask to do private. You understand? You pay out of pocket. If you want somebody that is just limited and just by what insurance, then you have to go with one of the agency. One thing I want to say to the folks out there, I know a lot of times, you might have certain things that you want to get done in your home, but if you feel as though your care is not, or your relative is not being taken care of in the way that you want them to be taken care of, always just go ahead and request a different aid or a different home health system or service, so for them to better take care of you. And for the nurses out there, the aides out there, I just want you to know that, remember, you're the backbone of the home health service. And without you, we can't do anything, all right? And don't feel as though whatever is happening in the system, it's because of you. No, it's a problem that has to do with the system. It's a healthcare problem, and it's not a home health aid problem. So don't feel guilty about what you're doing right now. Just continue doing what you're doing, and that's the most important thing. I do hope that, anybody that is watching this video get a gist or understanding as to what I'm saying regarding the home health aid and their responsibility and how they're being paid and why they have to leave in such a rush sometimes and why they're not able to do certain things, because at the end of the day, it is all about this. They're not getting sufficient money, and so in order to make a living, they have to move on to the next patient, and that's just the reality of life out there for them. See you in the next video. Go ahead and follow me here for more. Subscribe to my YouTube page at ThinkNursing, and most importantly, turn that notification bell on for more content related to nursing, travel, and lifestyle. Until then, I'll see you in the next. Bye.